On November 7, Maine voters will be the first in the nation to determine the fate of Medicaid expansion in their state. The issue has been a contentious one in Maine since the 2012 Supreme Court ruling granting states the power to decide whether to expand the program to more low-income Americans. Republican Governor LePage has vetoed the legislature's 5 attempts to expand Medicaid, arguing that it is a measure of pure welfare that would significantly impact taxpayers, according to the New York Times. 31 states in the District of Columbia have already expanded Medicaid, covering adults up to 138% of the federal poverty level under the Affordable Care Act. As a result, about 11 million more Americans have been made eligible for health care coverage. If Maine voters decide to expand the program known as MaineCare, 70,000 people with incomes at or below $16,643 for a single person or $22,412 for a family of 2 would gain health insurance, according to state estimates. Though Maine's uninsured rate has dropped since the ACA was implemented, from 11.3% in 2013 to 8.7% in 2016, the improvement has not been as significant as that in expansion states, which saw their uninsured rates drop an average of 5.5%, according to the Kaiser Family Foundation. For some low-income citizens in Maine, the expansion is their only hope of covering their healthcare needs. And with so many people currently without health care, the state's hospitals have had to take on more than $100 million in annual charity care costs, or costs from treating those without insurance, according to the Washington Post. But LePage argues that the federal government only covers 100% of the expansion cost until 2020, when the state would become responsible for 10% of the bill. He says the expansion would force him to allocate $54 million from other programs, including those helping the disabled and elderly, to pay for Medicaid costs, the Post reports. Opponents also point to the fact that Maine suffered when it expanded Medicaid in 2002. They claim that the state's uninsured rate did not improve and that Medicaid costs formed deficits during the nation's economic decline. Maine's ballot measure, called Question 2, comes at a time when President Donald Trump and Republican legislators are attempting to repeal and replace Obamacare. Thus far, their attempts have proven to be unsuccessful. Though Senator Susan Collins, of Maine, is not taking a position on the referendum, she has been outspoken in her opposition to the GOP healthcare repeal bills. As voters head to the polls, other states are watching Maine closely, particularly Idaho and Utah, where health advocates are also attempting to give the public a final say in Medicare expansion. If the referendum passes, the governor will not be able to veto the decision. The legislature could try to block it, but that is considered unlikely since it has attempted to expand Medicaid 5 times. Tags: Affordable Care Act, Healthcare Reform, Medicaid Maine, Voters, LePage, Health Insurance, Donald Trump, Susan Collins.